This is Urban Health Today, and I'm speaking with Alisha Bridges, a patient advocate and influencer who has plaque and scalp psoriasis. She's here to talk about her experience with psoriasis as a person of color and how patients can advocate for themselves to receive the care they deserve. Thanks for speaking with me today, Alisha.
Of course. So happy to be here.
It's so nice to have you. All right, let's get started. Can you share your personal experience with plaque and scalp psoriasis? How did you first think it would impact your life?
So I've dealt with severe plaque psoriasis since about 7 years old. So it's been 3 decades now. And
Mhm.
it happened after a really bad case of chickenpox. My grandmother noticed that, the scarring that you typically get from chickenpox was kind of morphing into something else. And I had this really itchy, flaky, inflamed skin that was appearing. And so at this point, I was like 90% covered with plaques, and being in Michigan and dealing with the brutal winters, that did nothing but just make my skin worse. And as I aged, and you have it at 7 as the adolescence, and then you become a teenager and you kind of notice how people look at you, the questions, it made me feel really insecure, and it made me feel like I needed to cover up my skin. So I stopped myself from doing a lot of things. I'm very tall. I've always been tall, and people would always ask me to play sports, but I avoided sports because I didn't want anybody to see my skin. There were certain social activities that I would not engage in because of my skin as well. And then on top of that, I also have scalp psoriasis. And so um, trying to tackle that, which is a challenge in its own, and finding the right medicated shampoos, having textured, kinky hair. I was unable to like wash my hair as frequently as the medicine required. And so, there was just always some type of challenge where now I have to either choose having, somewhat healthy hair but a horrible scalp, or clear my scalp up, and now my hair is suffering. So it's definitely been a
Hmm.
struggle throughout the last 30 years.
Oh, wow. Did you face any obstacles in receiving an accurate diagnosis? And how did misdiagnosis or delayed diagnosis affect you?
Absolutely. I think there's a special challenge of being a person with color who has plaque and scalp psoriasis. You have to deal with sometimes misdiagnosis, a delayed diagnosis. There's a lot of treatment barriers that happens at a much higher rate as being an African American person. I was raised by my grandparents who I think had me on a special type of insurance, which really made access to care difficult. I remember being misdiagnosed in my teenage years, and even in my 20s, where I met with a doctor and she said, "Oh, you might have something else." She gave me a biopsy and said, "Oh, it's psoriasis." So it's always a challenge. I've seen the misconceptions. Some people don't even think that Black people get psoriasis because it's not something that is at the forefront.
Wow.
Psoriasis also appears very different in our skin. Like, I remember going to that doctor in my 20s who first gave me that biopsy because she looked at my skin and was like, "Oh, I don't think you have psoriasis." And she said she didn't think it was psoriasis because the way it appeared. She had learned from her textbooks that psoriasis typically appeared red. And here it is, my skin was brown and purple. So because she did not have that exposure to how this disease appeared in other skin tones, she thought maybe I had something else, which led to the biopsy. So it's definitely been a challenge.
How has the lack of representation in dermatology research impacted your treatment options and overall care?
Well, as I just mentioned, here is this incredibly intelligent and smart doctor who didn't know how psoriasis appeared on darker skin. And I think the problem with that is that the textbooks that they're learning from when it comes to dermatology, they're not seeing enough of diversity and representation so that they can see the differences in how a disease like psoriasis appears. You know, the lack of representation for psoriasis and skin and color can really lead to delays in finding effective treatments. And it leaves us without access to care. It causes us to have to takes us longer to get to treatments, which it kind of all goes hand in hand, because if it takes me longer to get to a treatment, that also means that my mental health is going to be impacted, because I'm walking through life with this very physical, visible, isolating disease. And so, you know, just the lack of cultural understanding and with treatments, you know, can really impact patients in a negative way. And just like I mentioned, you know, that shampoo for my scalp psoriasis I was prescribed required me to use it every day. But as a Black woman, you know, I wash my hair once a week. Like, even
Right,
dermatologists would suggest that you're a Black person with kinky hair, you wash your hair once a week because you don't want to strip the oils. And
right.
so just a challenge like that, where it's like there's not even a treatment that is catered to who I am as a Black woman. And, you know, many of us face those type of challenges.
And in what ways did psoriasis affect your mental well-being?
Ooh, that is a long list. You know, this disease has made me question my worth. It has made me isolate. It has sometimes impacted my ability in the way that I show up in the world. And it's so crazy because not even like being on effective treatment and my skin is clear plaques. Um, Sometimes with the discoloration, I still feel the need to like cover up, or I still feel insecure. And so I remember just growing up, especially in late teen years and early adulthood, like experiencing anxiety and panic attacks, and didn't even know that that's what I was dealing with at that time. I don't even think my family understood it, because there's another challenge growing up in a Black home. Sometimes we did not understand like the mental health challenges and aspects that came with this. So
Right.
I would have anxiety, which now I know my anxiety presents as irritability. And I remember being a teen and having anxiety and feeling very irritable and getting in trouble because it was looked at as, oh, you have an attitude. But I didn't know to say I'm having anxiety. And they weren't aware or educated about the effects or impact or how mental health shows up to even identify that or address it in the right way. That's something that I had to figure out as I age. So it's definitely has been a struggle for me, as well as a lot of other patients that I talk to living with psoriasis.
And so you found this out from speaking to mental health specialists or just in your journey reading and et cetera?
It has been a combination. It's been, I have a therapist. I've been in therapy for 10 years now. So learning it through that, learning it through books, going to college and just being exposed to more through classes.
Mhm.
Yeah, so that's how I found that out.
How important are community and support networks for individuals dealing with psoriasis, especially among people of color?
It is extremely important. It's imperative, not only for your physical health, but your mental health, because it's a blessing to see other people that look like you that can relate to you in your struggles. You know, with psoriasis taking such a physical and emotional toll, you really need support to help you through, whether that's medical, whether that's community, whether that's family and friends. It's really important to find that. And honestly, I connected with the National Psoriasis Foundation now almost 14 years ago, which is crazy to say out loud. And I remember going to my first conference and being the little only Black face in the room at the time.
Oh,
But
wow.
yeah, it's so crazy how much it has advanced since then. Every time I see one of my sis or one of my brothers, I'll be so excited, like, oh my goodness, we are like coming out more and sharing our experiences. And even being in that room, you know, relating to psoriasis sometimes goes beyond color, right? Because here I am, one of the only Black faces in the room, but this was the first time that I had ever met this many people with psoriasis who were standing in their truth, who were living confidently, who were also trying to figure it out like I was. And it really inspired me to find my authentic self, regardless of my disease. And it really empowered me to do something different and to stop living in fear.
Alisha, what motivated you to become a patient advocate and influencer? And what do you hope to change through your advocacy?
Yeah, so going back to that conference, I remember they had a workshop on blogging and sharing your experience online. And I remember sitting in there saying, "Oh, I could do that." Because at the time, sharing my story online was kind of a safe shield, because I could write something or share a picture, I could close my laptop, and I could go on about my day without necessarily being confronted with the comments or the fears that would plague my mind if I'm out in public with it. When you're out in public and somebody sees your skin, you can't just walk up to them and say, "It's just psoriasis." But online, I could put a picture up of my skin and say it's psoriasis, and people understand exactly what it is. And the support that I got online once I started sharing my pictures just really encouraged me to take it to the next level. And so I advocate on behalf of patients to bridge the gap between the medical community and those living with chronic illness, especially those who are Black living with psoriasis. It's given me a space, a safe space to tell my story, to share my experiences. And I've also had the opportunity to learn how psoriasis impacts others, because this disease affects everybody differently. And so, you can have somebody who's 90% covered like myself, and another person who may just have psoriasis on their face. And even though it's like two different places where the disease is, the severity and the mental and emotional tolls are just the same. So yeah.
Do you feel that people in your advocacy are you getting the sense that they're holding space for you for your story? So in other words, they're like holding space and looking and saying, "Yes, I see you, I hear your story, and I appreciate you."
Absolutely. Absolutely. The work and progress that I have seen in the last 15 years with psoriasis in general, but especially for those of us who are people of color living with psoriasis, is definitely starting to get better. So, yeah, I feel seen. I feel like my voice is being heard, but I also feel like that would not be possible unless I'd speak out. Like, the only way this is possible, the only way you start to really get your story taken seriously, is by speaking out, being vulnerable, and being honest about how this disease really impacts you. So yes, I feel seen, and I'm really excited about how psoriasis research, especially for people of color, is progressing, and the things that we're finding out.
What advice would you give to people of color struggling with psoriasis and similar challenges?
The advice I would give is to find a doctor that you trust. Find a doctor who is familiar with clinical trials. One of the things that I love about my doctor, Dr. Jamie Wiseman out of Atlanta, Georgia, is she really deals with the disease states. And so she does a lot of clinical trials. She's constantly coming across different people of different ethnicities. She knows the importance of that. And so I think it's really important to find a doctor who really values research. So that's number one. Um, I would say if a treatment is not working for you, to be very vocal with your doctor about it. Some people feel as though they don't look at their relationship with their doctor as like a give and take relationship. They see their doctor as an authoritarian that has all the answers. And although your doctor is there and has a lot of knowledge about diseases and how they impact people, you are your biggest advocate and you know yourself best. So that really allows you to make a working relationship with your doctor. It's not an author. They don't, they're not an authority over you. So if a treatment isn't working for you, like I mentioned, the shampoo for the scalp psoriasis, the only way that we will shed light to the cultural differences of having psoriasis as people of color is to speak up and say, this does not work for me. To not be afraid to say that, to be honest and upfront with your doctor, and to make them notice you in a way that it forces them to come up with better options for you. So to me, that is empowerment, and that is the advice that I would give to people struggling with psoriasis and just finding the right treatment.
Okay, let's stick with that. What changes would you like to see in the healthcare system to better support patients of color with psoriasis?
Well, a lot of people of color, like, they don't feel seen, and I've come across a lot of different people who have felt that way. I live in a big city. I'm very involved in advocacy. So my experience is kind of different than the average patient.
Right.
There's a lot of people living with psoriasis that don't have that type of access, exposure, or may not even have that type of social opportunity in their area. And so what I really like about working with Johnson Johnson is doing the visible study. Is the first of its kind, is 100% dedicated to diverse patients like myself. And it really will help to build the gap between research and dermatology and people of color. It helps to educate health professionals as to how psoriasis appears in skin of color. Not only that, but how it impacts us emotionally, how there are cultural differences with dealing with this disease. And I really believe that having photos and images of psoriasis on all different skin tones, especially the darker skin tones, will really help us to improve the future of diagnosis and treatment decisions for people of color with their healthcare providers. And so seeing other patients with my skin tone and learning how medications have helped them and treatments and seeing research being done in this area just really just puts fire in my heart and makes me want to work harder so that the next little Black girl who is diagnosed with psoriasis at 7 years old doesn't have to suffer the way that I did for the last 20 years. And she will get a treatment much faster. And yeah, so I'm really excited about this work, and that's what I hope to see in the future, continue to see.
How do you see the conversation around psoriasis and skin conditions for people of color evolving in the coming years? Is it evolving?
I think it is evolving. As Black people, we've always had challenges with trusting the healthcare system for a variety of reasons. We know and understand the history in this country. But we are walking into changing times, and I really think it's important for clinical studies to be inclusive. Sometimes I will go to different research events and I'm looking at the data and it shows you the demographics, and so many times there's not enough people of color. And then sometimes you will have Black people represented in the study, but then you don't have any Asian people, Indian people to be exact, who have darker skin tones. Like, what is psoriasis like for them? And so I really think we need the clinical studies to be more inclusive, to include people of Asian descent, Hispanic descent, to include people who are Black. And just really explore how this condition impacts us from physical, emotional to our day-to-day life. And I really think that participating in clinical trials is a powerful way to not only help yourself, but to help your community. I really believe that there's value in using yourself as a way to advance medical research so we can get to better treatment options. And so my hope is that by raising awareness of these issues and telling my own story and helping to put the stories of others at the forefront, that we'll see an increased level of representation in dermatology research moving forward. So I'm really excited to see where this goes.
Final question, Alicia. You said earlier that you finally achieved clear skin. What are you using
Um,
to clear your skin up?
so I'm on a biologic, and I also use over-the-counter topical treatments as well.
Oh, a biologic. Oh, okay, that's great.
Mhm.
Alisha Bridges, thanks for your bravery and for your advocacy work. Really appreciate talking to you today.
I appreciate it as well. Thank you so much for your time and putting these issues and challenges with psoriasis for people of color at the forefront. It's great. The more of these that we do, the better we can educate the public and advance research.